This presentation will discuss stress and performance in relation to paramedic practice with reference to the case study.
The aims of this presentation are: how can we define stress, causes of stress for ambulance personnel, theories of stress, how does stress impact performance, and how can we reduce stress within the ambulance service.
91% of paramedics state that they are suffering from stress, with 38% taking time off sick due to work-related stress, such as Peter in the case study. By exploring research surrounding stress and performance, we can gain insight into the true impact stress has on ambulance personnel and explore methods to prevent the development of chronic stress and its resulting health issues. There is evidence to suggest that investment in the health and well-being of employees improves productivity and is cost-effective for the wider society.
Stress can be defined as the body's response to a situation which may make one feel overwhelmed or unable to cope. Physiologically, this happens through the release of cortisol. Research shows that prolonged stress is linked to conditions such as anxiety, coronary heart disease, musculoskeletal pain, and migraines. Stress is not a psychiatric condition, however can prelude mental health problems and vice versa. In Frings-Driessen et al. 2003 study, researchers found a positive correlation between the severity of a patient's condition and the volume of cortisol released by the clinicians attending the call. The study also identified that more calls the EMS personnel attended, the longer the duration it took for the individual to recover and cortisol levels to reset.
Michie 2002 suggested that common triggers of stress revolve around the workplace. Work-related stress is defined as a harmful reaction that people have due to undue pressures and demands placed on them at work. Work-related stress is particularly prevalent in the healthcare sector, which is under increasing pressure due to the rise in demand. HSE created a framework of 6 management standards which, if ill managed, lead to high levels of stress and reduced job satisfaction. Demand refers to pressures associated with workload, shift patterns, and work environment. The paramedic role is highly demanding in terms of workload and how often employees are required to be on shift. The 2015 Unison survey found that shift work was the leading cause of stress for ambulance personnel, with 74% of respondents experiencing sleep problems and irritability as a result. Peter and Hanan were on their 4th 12-hour night shift in a row in the case study, which can explain why Peter was described as abrupt. Due to the nature of the job, shift work is unavoidable. However, it has been suggested for the effect of shift work to be minimized. Shifts should be rotated every 3 to 4 days, and it should be done rapidly rather than gradually, otherwise the sleep debt accumulated cannot be resolved. Control is how much say employees have in the way they do their work. Support involves the level of encouragement and resources employees receive from management. Relationships include creating positive work relationships and dealing with unacceptable behavior such as bullying or discrimination in the workplace. Halpern et al. Found that ambulance workers often suppress feelings of stress due to concern that expressing their emotions may compromise their position in the workplace. If staff feel unable to express emotions due to stigma in the workplace, this can lead to the accumulation of stress. Role principle is whether staff understand their responsibilities and scope of practice within the organisation. And lastly, change involves how organisational change is managed and communicated to the workforce. This is particularly important in the NHS as it often undergoes organisational change. As many of these factors are often interlinked, once stress is caused in one aspect of a job, there is potential for a snowball effect to occur. For example, if an individual hasn't got full clarification on their role within the workplace, inter-colleague conflict may be triggered as there is ambiguity as to what they should be doing. There is also potential for this work stress to continue outside of the work setting due to the dreading of going back to work. This framework is supported by a study by Carr et al., which found the management standards were positively associated with job satisfaction and negatively associated with job-related stress, anxiety, and depression. This empirical evidence increases the reliability of the HSE management standards as a model. However, this model has been criticised for holding management accountable as the only entity responsible for resolving stresses, when employees are also responsible for finding solutions and developing coping mechanisms.
From a behavioural perspective, an individual can become classically conditioned to associate stress with a specific trigger. Classical conditioning works on the principle that a factor which would not have originally induced stress responses, otherwise known as a neutral stimulus, converts to a conditioned stimulus after being associated with something that typically induces stress. Watson and Rayner conducted a study on participant little Albert, who originally had no emotional reactions to rats. Throughout the study, the rat was accompanied with a startling noise that induced distress. After this was repeated over time, even when the loud noise didn't co-occur, the rat still caused a fear response, suggesting emotions can be learned. This explains why what can cause stress for one person doesn't evoke the same response in others. This theory can be applied to ambulance personnel who attend traumatic calls. Stress may become associated with non-threatening stimuli that were present at the time of a call. For example, if a stressful cardiac arrest is then accompanied by a frequent radio broadcast, potentially in the future, receiving radio broadcasts could trigger a stressful response. Fowler and Cohort suggested most people attending a traumatic event feel that they are unable to cope with stress and associate non-threatening stimuli with danger. However, if individuals avoid the stimuli, they will not have the opportunity to correct their pathological associations, and this may lead to PTSD.
A strength of the behavioural approach is that it offers insight into how PTSD can develop from stressful situations in the workplace and how CBT can be an effective treatment. This is particularly important as 22% of paramedics had clinically significant symptoms of PTSD. Cognitive behavioural therapy involves changing the way an individual thinks and behaves in response to situations. Foer and Kozak suggest that for successful recovery using CBT, one must present the conditioned stimulus with information that replaces pathological thoughts with realistic ones to prevent the stress response. Alternatively, it could be argued that this theory is reductionist, as it fails to consider factors such as motivation, emotions, and expectations in stressful situations, as well as individual differences which can have an impact on how an individual responds to stressful scenarios. Van Dura coined the term self-efficacy, which refers to the extent to which an individual feels in control of their life. Individuals who have higher self-efficacy levels are more likely to respond to stressful situations in a positive manner than those with lower levels of stress. In addition, behaviourist theories often use lab studies, which are said to have low ecological validity due to creating artificial controlled environments which do not reflect real-life situations.
So how does stress impact practice? To an extent, pressure can motivate staff and enhance performance. However, when the pressure exceeds one's ability to cope, this can lead to a negative impact on practice. For example, disengagement, lowered confidence in care delivery, absenteeism, and negativity towards working with patients, such as Peter's treatment of Alan in the case study. One theory which looks at stress and performance is the Yerkes and Dodson law. Yerkes and Dodson found that there were optimum levels of stress whereby cognitive tasks could be completed at a high quality. They found rats could be motivated to complete a maze with electrical shocks, but when the shocks were amplified, their performance levels decreased and were unable to complete the maze. They concluded that arousal levels helped to focus attention, but only until an optimum point, suggesting that under higher pressures there's a decrease in performance. Understanding that high levels of stress is detrimental to performance is valuable in the clinical setting, as it indicates that actions need to be implemented to prevent patient care being impacted negatively.
As discussed, there's a clear relationship between staff well-being and patient care. Therefore, it's in management's best interest to ensure stress levels are minimised within the workforce. Research suggests that identifying emotions is a key component in managing stress within paramedics. A study conducted by Yazdani et al. Shows that holding stress management workshops improved mental health amongst the student sample used. This could be implemented in the ambulance service, however this could be deemed as costly and time-consuming. Also, it should be noted that the student sample is comprised of those from an Eastern culture. Perceptions of stress and mental health within these different communities could reduce the applicability towards a Western culture. A study investigating medical rescuers who had experienced a traumatic event found that avoidance techniques such as self-distraction and emotionally focused strategies, such as seeking social support and counselling, were more effective strategies in post-traumatic growth than techniques which focused on the traumatic event itself, such as venting or self-blame. However, the study relies on self-report data, which causes internal validity issues as participants may have felt inclined to report positive changes for social approval and may not have wanted to admit struggling to cope.
In comparison to typical lines of work, pre-hospital care involves more exposure to higher pressure situations. Due to the duties ambulance personnel have within society, the benefits gained from addressing stresses outweigh the resources they require.
Here are our references.